lab, folks. So myself, Wing, Nadine, the camera woman, and Andre have the pleasure of teaching everyone to use a pleura evac in the situation of a pneumothorax patient. I will be the pneumothorax patient. You will need the chest tube, right? You have gloves, generally sterile gloves. You're gonna need suction tubing to attach from your pleura evac, suction tubing to your suction setup, and then we'll adjust the amount of suction that we will use.
All right, knock knock. Hi, my name is Andre. I'll be your nurse.
Hi.
All right, how are you doing right now?
Right.
Okay, let me get your name and date of birth.
My name is Wing. My birthday is 01/23/1978.
All right, and do you know why you're here?
I had a collapsed lung.
Okay, and so from here, I would check for the patient, see how she's doing, how she's feeling, if there's any anxiety, and from there, I would do checks for vital signs, check her breathing pattern. I would listen to her breathing, and then from there, I would check her dressing and her chest tube. So right now, I would check to see if there's any excessive draining, and if there is, and from there, I would actually touch around and check for any sort of crepulence, and if there's any air leakage or anything leaking into the pleural cavity. And from there, I would check to see if there's any clotting in the tube. I would check to see if everything is taped up, which it's not. So I would tape to make sure that the tubing is all connected with 1-inch tape. I would also have gloves on at this point too, which I don't have. Alright, I have the double tape. And I would check for any sort of clots, any kinks, and from there check all the way to the bottom. I would not lift up this, oh not the bed, it's on it. There it goes. And I would not lift up this above the patient's chest cavity, but I just want to show how it looks. So what you'd want to make sure is that the water level is at 2 centimeters. For this system, we do not need to fill it up to 20 milliliters. And I would check to see if there's any odd color drainage or anything that came out of here. All right, so what we're gonna do right now is check for any sort of leakage in the chest tube. So right now I can see immediately on the PleuraVac that there is some aggressive bubbling, which indicates that there is likely a leak somewhere along the line. So what I would initially do is just do a quick check of all of our suctioning equipment, check to see, make sure everything is just physically attached, check if there's any like displacement of the taping, and then I would make my way over to the patient. And I would grab my tools, whether it be a slide clamp or a butterfly clamp, or in the last resort, you can use your fingers. So what you need is 2 fingers, 2 slide clamps, or 2 butterfly clamps. And what you're gonna wanna do is start from as close as you can to the patient, and what you wanna do is just clamp it on, one before and one after. And what you can do is you're testing little segments of the chest tube. And you're gonna check to see, you're gonna clamp it off. This system isn't perfect, so we're going to see some bubbling still. But you would ideally not see any bubbling. Everything would be completely closed off. And what you would want to do is just keep moving down the line until you saw any sort of aggressive bubbling. Light bubbling is obviously okay, but you just keep moving down the system to make sure everything is okay. And
that sums up our pleura evac situation.